Firstly, thank you everyone that's joined us that is now this afternoon. We're really pleased to be having this discussion. Our webinar today will last for an hour, and it's going to be myself and Adam running you through the discussion, but with opportunities to engage in the discussion, and we do want participation, and we'll do that through the Slidos that we have sort of dotted through today's discussion. So let's start with some introductions. Adam, do you want to sort of introduce yourself to the audience?
Yeah, thanks, Rich, and good afternoon, everybody. Thank you for joining us. We really appreciate you doing so, and it'd be great to hear from you, both in the sort of Slido polls that we have, and if you've got any questions to put to us, we'll try our best to answer them. I'm Adam Huxley. I'm a consultant clinical forensic psychologist and one of the co-founders of Thrive. I've been a clinician for over 25 years and have worked in a variety of clinical settings, predominantly with men. So this is a subject I've got quite a bit of interest and experience in, and usually with men who've got quite severe and enduring mental health difficulties, including men that have had feelings around ending their life, as well as self-harm. So yeah, we're looking forward to talking about a difficult topic today, but it's a necessary topic for us to think about. Yeah, and we'll see how we go. So welcome.
Great stuff. Thanks, Adam. Certainly got the right co-host for this discussion topic. So my name is Richard Middleton. I head up the customer success team at Thrive. Really passionate about this subject, the subject matter. That's why I do what I do. And looking forward to taking you through today's discussion with Adam. So let's move on. You can see on the screen what we're going to be discussing. I did want us to kind of start the discussion, though, by contextualizing a little bit. And sometimes working within this sector, and by nature of the job that I do, my perspective is just that. So I'm very keen to see how the audience engages with some of the Slido polls that we've got, to see what you think about this issue, and to see if you know how bright you think the spotlight is shining on mental health. But we will discuss the topics that you can see on the screen. So some of those barriers that men in particular experience, the issues, some of the resistance that men might have in accessing support and treatment, and then we'll dip a little bit into what the future might look like in terms of creating a better and more supported journey for men with regards to their mental health. So we also recognize that in this time that we've got together, that there will be people that need to drop off for whatever reason. So we did want to sort of top and tail the discussion, as you kind of said to me yesterday, Adam, with some resources that we have available for those individuals that might be not feeling so good, might be struggling. So you know, some of you who will have joined will have access to our own service, Thrive Mental Wellbeing, where you can speak to therapists about your challenges. But we did want to highlight, you know, there's lots of very good organizations out there where you can seek help and support. So these are just a selection. As I've said, there are various organizations out there. And for those that attend the webinar today, you'll get the recording and you'll have all this content sent through to you after the webinar. And at the end, we'll be sharing some of the same resources with a few more for you to have a look at. But they are on the screen there for you now, if anyone does want to take a note of those or take any action with that. Okay, so let's start here with the first Slido poll. So if you haven't used Slido before, it's pretty easy. So what you have to do is scan with your phone the QR code that you can see on the screen, and that should take you to this page and it'll ask you these questions. Alternatively, you can go to slido.com and then enter that hashtag 3407105. So yeah, already getting some responses in there. Which statement resonates with you the most? So we're talking about, have we got it about right? Is there enough of a spotlight on mental health? Is there too much of a spotlight on mental health? So we'll give it some time for everyone to sort of engage Interestingly, no one's put too much of a spotlight on mental health. We've got it about right is just edging at the moment. Someone's obviously heard me talking there. Okay, not enough of a spotlight on mental health, just lagging behind. We've got it about right. Okay, interesting. So I didn't know which way this poll was going to go. It looks like we've got it about right is the sort of majority feeling in the webinar today. There's certainly no one who says there's too much of a spotlight as it stands at the moment. And fortunately, and perhaps not massively surprising given the audience and the content, we've only got a very 1% for those no spotlight at all. So the majority are going with we've got it about right. So moving on from that, this I thought was interesting when doing some of my research for this webinar. This is from a well-known sort of intermediary advisory in the market. Just around or just over half of companies provide support for their employees with regards to mental health and well-being. And that's even more interesting when you break that down. So this research that was from we've gone too fast. Let me go back. This research that was from 2023 suggests that around 70% of large corporates have support, and it's just over 50% for SMEs. So the SMEs and smaller businesses sort of lagging behind some of those larger corporates. So yeah, despite more of the noise, and I do feel like there is more and more noise, and I think that's in a positive or should be taken in a positive sense. There's more noise around mental health, yet there's still, from an employee's perspective or employer perspective, only just over half are providing support for mental health. And I think this is interesting. You've got around 8 to 10% of budget for the NHS being spent on mental health services. And this is the highest spending, at least predicted, that it's ever been, nearly 17 billion. Yet from what we understand and what my perspective is, Adam, looking out from a Thrive perspective, that despite the spending, the challenges still exist in terms of accessing support in a timely manner. Is that kind of a view that you would share, or do you want to expand on that?
Yeah, I mean, you know, the first thing to say is it's great that there's that amount of resource that's been considered to be allocated to mental health services. Those of you who've been around for a long time will know that, you know, many times in the past, we've often talked about the opposite, which is there's not enough resource to support mental health services. And one of the things that we've seen as a result of mental health coming alongside physical health, they're no different in reality, but I think historically they kind of got viewed as different things, was that there's greater awareness and therefore perhaps problems were more readily identified, and then the cohort of people who want to access services has steadily increased. So there's needed to be a response from the government in terms of how you source those services. How do you meet the needs of this emerging population? Maybe it's always been the same. It's just that we've got better at uncovering the issues. So that's the next challenge, really. How do you provide services for people that need it? How do you make sure that there's this thing called early intervention, which we'll make reference to a lot today? Early intervention really stops things from progressing to a crisis. And that's really what all healthcare services want to do, is to intervene earlier on. So whether that's accessing your GP or A&E, it's better to try and stop the problem from snowballing into something more significant. So it's great that that message is out there. The thing to try and figure out is, where does that resource go to? Because mental health services is a large piece. It stems from inpatient admission in a mental health facility right through to community services where you walk through the door when you've taken time off from your employer. So it seems like a lot of money, but it's got a long way to go. But it's definitely really positive to see that the government have really started to address this. So I think we're all quietly optimistic, those of us who work in services, that this will trickle down into grassroots services so that we're able to reach more people and respond a bit more appropriately.
Thanks, Adam. It's just interesting what you said there around, and forgive me, I'm paraphrasing here, but mental health may be treated or seen as slightly different to physical health. Would a more helpful label just be health then? When you know, are we thinking about, you know, we'll get on to coping mechanisms, but there's a very different, or at least my perception is different perception towards stigma around, you know, for example, going to the gym. You know, lots of people looking after their physical health, yet mental health is seen in a different light, isn't it?
Yeah, I mean, when we've run this session quite a lot over the years, and when we listen to people who attend, there seems to be a theme in terms of how men in particular describe their difficulties. And we'll talk about this a bit further on, but perhaps one of the reasons why men in particular don't always reach out for support is that feeling that they'll be stigmatized in some way, or that people will think differently about them if they admit to having an emotional problem. But when you think about, and again, we are going to talk generally, and of course that doesn't mean that that's the case for everybody, but generally it may be the case that men maybe over-endorse physical health problems, but minimize the way that they feel emotionally. If I think of myself growing up, when if I broke an arm, I was really quite happy to show everybody the cast and explain, how bad it was, but might be a bit more difficult for some men to talk about the way that they feel. So yeah, I think because we've got better at talking about it, because we've got better about listening, I think it's easier for men to sort of reach out and talk about the way that they feel, now more so than it has been maybe historically.
Yeah, it's interesting, the language that we use, right? And I don't know what the right answer is on this, but whether there's more accessible language that should be used. Obviously, you can get quite clinical language in terms of categorizing conditions and things like that, but also in the imagery that tends to be used a lot around mental health is, head in hands type things, which, okay, that may resonate with someone that's struggling, but what about getting ahead of the problem earlier? Is that the right imagery to use? I don't know. But we'll discuss a bit about that a little bit later. I thought this was interesting. Certainly sort of polarizing, but former Secretary of State for Work and Pensions, Mel Stride, mental health culture has gone too far. And in the article, he was referring to, we're almost over-indexing, in his opinion, on this issue. And, at the time of this sort of being, this quote being out there were sort of several mainstream media that kind of align with this view that maybe we've gone too far with the discussion, and that, again, sort of paraphrasing, but people are becoming a little bit weak, if you like, in their ability to deal with things and resilience. So I think I sometimes, because the nature of the work that I do and who I work for, I think it's important to have perspective and understand what some employers may be thinking, and to understand that this is a nuanced debate, right? Some people think there's not enough of a spotlight here. We saw from the poll, the people on the call think we've got it about right, but there are perspectives out there that go the other way with this topic. That being said, this is I guess the stark reality of some of the most disastrous consequences of poor mental health. And even though, and keep me in check here, Adam, if I say anything wrong from a clinical perspective, but from my understanding, more women are impacted by anxiety and depression, but when it comes to suicide, it's kind of adverse, the proportion of individuals that are impacted, men are the people that tend to come off worse in that sense. So this is really quite, I find it quite sobering looking at these stats, but when it comes down to it, this is the journey that unfortunately some people will take, and we're here to raise awareness on this and hopefully get people into a mindset of hopefully seeking support earlier on in their journey. So from my perspective, and that is just one, I don't think we're talking too much about it and we've gone too far with this issue at all, because we still have lots of people that are challenged and are struggling. Okay, back for another Slido poll now. So what do people think prevents men seeking help for their mental health? So give that a scan. We've got a word cloud, I believe this is. So you can see people are starting to type, and then we'll sort of respond as we get a few responses into the... Okay, so stigma, pride, masculinity, idiots like mouse stride. Yeah, we've got weakness. We've got some sort of call outs of, if you like, quote unquote, celebrities who may have particular views on masculinity that might be adding to that challenge of men seeking help. Trying to see if there's anything here that looks kind of something that we wouldn't expect to see. Knowing where to turn. So we've got one there about accessibility maybe, or knowledge of what services are out there or where to access them. Yeah, so I mean, some very similar themes in this. From your perspective, Adam, in you know, you mentioned around your clinical experience, do these sort of words that are popping up on the screen sort of ring true with what you experience?
Yeah, and thanks for populating that. Yeah, I mean, I think we look at sort of themes that emerge from our experiences, and those are important to look at because it's how we try and design services so that they become more inclusive. And what inclusive means is you try and get rid of some of these worries or concerns to make it more accessible. So you can see just from that word cloud there that, I mean, two of the ones that jump out are pride and stigma. And it's important to understand the social context within what we're talking about, and the social and cultural context of being a man today, where we are right now, unfortunately means that some of these things are still real issues for people. And some of them they seem like quite legitimate concerns, don't they? Because, you know, when you go and seek support, you're not entirely sure what's going to happen. Maybe you're concerned about confidentiality. Maybe you're concerned about reaching out to your employer because they may think differently about you, and that might harm your chances of moving on through the company. So there often seems more barriers to reaching out than there are motivations to reach out. So you can begin to understand, and this isn't just for men as well, by the way. This is for anybody who's seeking support. They just might be unsure about what the cost or benefit is of reaching out for support. So the first thing we have to do as a service provider is to try and reduce a lot of those barriers to entry. One of the big things that we've talked about previously is just making sure there are services. That's the biggest barrier to entry, right? If there's no service provision, then you might have to go shopping around or looking in other parts of the UK to access services. So that's a big part, just simply having the service. And then it's how the service responds. So understanding that, as Richard said, language becomes really important. Maybe there's adjustments that we need to make in terms of, you know, how we contextualize seeking support. For example, you know, historically, I've run a men's group. That's what we called it. And that was it was really a group for men that had pretty severe mental health difficulties, but the choice of how we described it was a men's group. So it wasn't pathologizing. It was, simply a statement about who was attending. It was a group of men. So for some people, that made the difference in terms of attending or not attending. So I think we'll talk about this, reasonable adjustments that we can make to the way that we deliver services to make it more appealing for people to join and to get help. Because we know, and we'll talk about this a bit later on, that the last thing we want is for people to not come into services because they're concerned about not getting the support, or they've got all of these sorts of worries that aren't really worries. And of course, we can't help people unless we know about them or we see them. So yeah, making those reasonable adjustments to the way services are provided, and then making reasonable adjustments in the workplace or even in our own relationships with each other is, things that we can do. They don't require us to have, a lot of resource. We can change those things ourselves, and that might make it a bit more likely that someone will reach out for support. But yeah, the similar themes across the past 5 or 6 years that we've been doing this. It's all about, the identity that somebody may have as a man and the cultural and social expectations that are put on them to maybe cope or just suffer in silence without seeking support.
Yeah, I often think about this. Again, this is not exclusive to men, but particularly within employers, the role of a leader or manager. We do lots of manager sort of mental health training, but there's that balance, isn't there, of vulnerability and also seeing as having your stuff together, and being that sort of strong presence when things might be a bit rough. But that sort of balance and I guess the employee culture has to sort of foster the right or appropriate culture that people feel like they can show a little bit of vulnerability whilst you're kind of wanting to give off the perception that you've got everything together, right? And that might not always be the case on a particular day. But it's an interesting one. Okay, let's move on. So again, this is a survey from the Priory, and I thought in sort of preparation for this webinar, when we think about some of the challenges or barriers that men face, and then this 40% of men wouldn't seek help unless they were having thoughts of self-harm or suicide. And when we're talking about the merits of early intervention in any health condition, right, it's particularly poignant with mental health, right? Getting on top of this issue early. So what is going on there that and maybe it's many of the things that we've just discussed on that slide that is contributing to this reluctance to seek help until you're much further down that journey. And I think focusing some attention on that challenge that we have in people just leaving it too late potentially to seek help is going to yield some value. Okay, so we wanted to make some of this sort of practical and give you a little bit of exposure and from the benefit of Adam's experience. So I thought what would be a nice sort of addition to this webinar was for you, Adam, if possible, to sort of talk through how you'd approach that question. How would you approach someone that you were worried about?
Yeah, I mean, we've put sort of clinicians' guidance there, but these are really communication skills, communication pieces of advice that we'd like to sort of share with you, and you may know some things that have worked particularly well for you in your discussions with other people, so it'd be great to hear those as well. I think the first thing to sort of just draw reference to is identification. So one of the things we always support people to think about is, how do you know that something is wrong in the first place? And given Rich's previous slide, you can see that men describe avoiding problems until they get to a really severe point, and only then do they reach out and get support. So as you've heard, what we ideally would like is to try and intervene a lot earlier on in that process so that things don't snowball to get to a catastrophic point. So we're really looking for things which are atypical. So that means different about the person. And they could be many and varied, but just to try and illustrate that with some examples, if somebody is really struggling at the moment, you may see some changes in the way that they relate to you. So they may talk less. It might feel a lot harder to start a conversation with them, so they may seem a lot more withdrawn than usual. You may notice that they neglect the way that they look. So maybe there's a change in their appearance. Maybe they took great pride in the way they dressed and looked, but now they're less concerned. Maybe they've lost a lot of weight, or maybe they've put on a lot of weight. Maybe they are less inclined to engage in social activities. So if you've noticed somebody avoiding planned social activities or just generally avoiding get-togethers, that might be a signal that something isn't quite as it should be. So we're really interested in identifying things which aren't typical of that person. It's not always the case that that's a reason to be concerned, and there might be another reason other than the way that they think and feel. But I think it's a signal for us to sort of be a bit more curious about what's going on for somebody. So that's the first thing, just noticing changes, which can be very subtle, in the person's presentation or the way that they usually act and feel. It could also be the case that you've noticed somebody be really anxious or really upset or really distressed, and then they become calm. That's also something that I'd be interested in exploring a bit further. It's kind of the opposite of what we've just said, but again, it's atypical. It's different from their usual presentation. So oftentimes you may just start that curiosity by asking how they are. I've noticed that you haven't been coming to football training for a couple of weeks. Is everything okay? Or I've noticed that you aren't taking as much time with the way that you look compared to weeks ago. Has something happened? So this curiosity is really important because it allows us to start a conversation. And I think it shows you the person that you're interested in their well-being. And oftentimes that's enough to just start the conversation about the way that they think and feel. The challenge there, as we've heard, is that, again, not all men, but some men avoid the discussion in the first place. So it's also about creating the right time to have that conversation. And we talk about having a compassionate conversation with someone. So context is really important here. Maybe you can't have that conversation with a family member, but it's a bit easier to have it with a friend. Maybe it's really difficult as a work colleague, but it's maybe a bit easier if you're somebody's line manager, because it's a conversation that could fit into line management supervision. But when we ask those questions, we try and do it from a place of, compassionate concern, which means that you're asking open-ended questions. What's going on for you right now? How are you feeling about things? They're all what we call open-ended questions that invite the person to tell you a little bit more, which is a bit different from, how we usually greet each other, isn't it? How are you doing? I'm okay. Are you okay? Yes. So you don't really get much of a conversation from those sorts of opening lines. So we want to be vigilant. We want to be curious. We want to show compassionate concern, and we want to start to ask questions that elicit information for us to try and decide whether or not somebody needs some more help or not. And that doesn't come naturally to everybody. It takes sometimes quite a bit of work in terms of how you ask those questions. You may not feel like it's your right as a friend, a family member, or a colleague to ask that person that, but you really don't know until you start the conversation. It might make a huge difference for that person that somebody's taken time out of their day to ask them how they feel. Those of you who worked through COVID will know that there was a big drive around that because people were working remotely, and that meant that you often didn't see each other for quite lengthy periods of time. So we were aware of different organizations just pinging emails across and having protected time where you almost had a forced meet where you set some time aside just to check in with each other and see how each other was doing. So those things can sometimes get lost in our day, and it's important to just remind ourselves to take time out, not only to see how other people are, but also how you're doing. So this is just a good habit to get into, to try and make sure that you're aware of any changes and that you've at least asked the question. And then when you've got information, you can make a choice about how you might want to support that person, or how you could signpost them on to somebody else to get them some support if they needed it.
Thank you, Adam. A couple of follow-ons from that. So what about people who might be worrying, a little bit nervous about approaching the conversation, and they say the wrong thing, and that leads them down another road? What would you sort of say to that sort of point?
Yeah, I mean, it's difficult, isn't it? And it's an added burden for you, which might feel a bit overwhelming. I mean, sometimes I think if the person receives the conversation in a way that it makes them feel it's compassionate listening. So it's not judgmental in the sense that you're not offering advice. So you're not saying, come on, you need to get over this, or you've got to be tough, or you've got to be resilient. That's probably not the best starting point. All you're really doing is asking them that question and listening. And you're helping them tell you their story at that point. And really, you're listening compassionately. So at that stage, you're not really offering advice. You're just giving people the opportunity to tell you how they feel. And then we often say, you can just reflect back the way that they're feeling. So, you can use statements like, that must be really difficult for you, or it seems as though you're struggling at the moment. That's just a very simple reflection, an affirmation of the way that somebody feels. You're not offering any advice with that statement. So you're not making them feel, discriminated or stigmatized, or in a way that they don't want to carry on the conversation. So it is a big burden when you get given that, piece of information. But I think our advice is just try and keep the conversation going. Don't feel under any pressure to offer advice. That's probably for somebody else. And the best thing you can do is just sort of carry on with that empathic listening, just being there and supporting someone to tell you the way that they feel. And at the end, maybe you ask them, what should we do about this? You've told me a few things today, and I'd like to help. And I'm just wondering if you had any thoughts about what we might be able to do to support you. So that way it's coming from them. They've told you the way that they feel, and you're inviting them to give you the answer. Not everybody will have the answer, of course, and then that maybe requires a bit of brainstorming. But yeah, I think it's just that. Just sometimes it's about avoiding things. So avoid being judgmental, avoid giving advice, even though it's really tempting, and avoid rushing to try and solve the problem for them, because it might be a bit more complicated.
Great, thank you, Adam. We'll move on. Hopefully that was a good insight into how you could approach what you're looking for, some of those things that might be different, the curiosity that you can show as an individual, that empathy, and really that you're not there to sort of advise, but you can sort of develop that plan with them as well. There's been a question direct to us around the full recording. It will be made available, so anyone who's attending will get emailed the recording link once we've sorted that out. Okay, so let's take a little delve into coping strategies, and I'm sure many of these will resonate with people on the call, and we're going to explore the topic a little bit more with Adam's help as well. So can you help just before we move into some of these unhealthy and healthy mechanisms, and perhaps engage the audience in some of the things that they do to support their mental health? What are we looking at here, Adam, when we're thinking about these sort of emotion-focused coping skills and the problem focus? What what are we sort of exploring here?
Yeah, I mean, I think, you know, we're all different and we've all got different ways of responding to the same event. And the quote you showed about maybe talking too much about mental health problems, it might be that person's reality, and that might be their perception of events, and that might be fine for them, but it's not everybody's perception of reality, and it's not everybody's understanding of the way that things work. So oftentimes when we're trying to support somebody to manage the way that they feel about something, which is usually something that's distressing, right? We try and learn from them in terms of things that have worked well for them in the past. And what you typically find, again, not all the time, but what you typically find is people choose to cope in different ways. And we've just separated those out in terms of emotion-focused solutions and problem-focused solutions. So this kind of depends on, you know, who you are and the way you think about the world and what's worked well for you in the past. So the problem-focused solutions are very much about addressing the source of the stress at its root cause. So that might be about changing a circumstance. I'm not happy at work because I work 60 hours a week. And my way of dealing with that is to reduce the amount of hours that I'm working. And I know when I do that, I'm going to feel less stressed. So some people are quite pragmatic about things and prefer a problem-focused solution. Other people tend to focus on their response to the event as it relates to an emotion. So they may address the feelings associated with the problem, which is, I have to work 60 hours. I know that I have to do that, but I'm going to change the way that I relate to it emotionally. So instead of finding myself stressed about the thing, I'm going to change the way that I view that. And that is very much around changing the way that you think and feel about something rather than changing the thing itself. Because maybe it's not possible to change the thing. So you see that a lot with people that have physical health difficulties, for example. Maybe it's not possible to change the physical health difficulty, but the way that you cope with it is to change your perception of it and the emotion that you've attached to it. And we found that people tend to fall into those two categories. Sometimes they do a bit of both, depending on what the issue is. But that's what we mean when we talk about sort of emotion or problem-focused coping.
Good stuff. Thank you. So we'll lean into those two particular areas when it comes to unhealthy and healthy coping mechanisms. And before I sort of ask for your thoughts on this, Adam, you know, I'm someone, and I'll come on to share a little bit about my own experience, but I think I do a bit of both. I think I do a bit of the healthy coping mechanism, and I'll talk about that. But sometimes it is easier just to go, you know, walk down the road. I've had a tough day. I've got something on my mind, whatever's challenging me, and have a drink or something. And it might not be to excess, but I think we need to be, you know, mindful that there's a reason we have a long list here, and that's for some people, even though these might or probably aren't the right way, if you like, to deal with them, we're human beings, right? And we don't always reach for the healthy option first.
Yeah. And there's a reason for that, Rich, because a lot of these are very accessible to us, and they're more readily available than perhaps taking the alternative route, which we'll talk about in a minute, which is the healthier coping strategies. So we've heard from people during the years that we've been running this webinar about the way that they've tended to cope with things, which has then just led to the problem escalating. So that's why we refer to them as unhealthy. You could also call them maladaptive, in the sense that they may seem to fix the problem initially, but they avoid it eventually, if that makes sense. So, I mean, Rich gave the example of, you know, a de-stressing technique, which is to go and, you know, go to the pub and have some alcohol, probably with friends. So that's a good part, that you share your concern with friends. The less helpful part perhaps is the de-stressing through taking a drink. Why is it unhealthy? Because it you know, for some people, you may need to do that a lot more to feel the same way. And that's when we've seen that people develop problems with alcohol or using drugs. But they can be appealing in the sense that they're readily available. You don't usually require any additional resource to do those things. So they're pretty good at avoiding something. They make you forget the issue, and therefore you avoid it. So it doesn't really solve it. It just kind of gets rid of it for a period of time.
Mm.
Other things we've seen are that, you know, for some people, their way of coping is to almost express that feeling outwardly through aggression. So if some people are under stress, they may be really short-tempered in their interactions with other people. So it's kind of getting rid of the feeling, but again, in a very unhelpful way. And avoidance is probably the biggest unhelpful coping strategy, because we all do it. We all avoid things because it's easy to do, and it's not pleasurable to have to deal with difficulties, is it? So if we can just push it down the road, then we'll get round to it another day.
Yeah.
But guess what? It's still there, and it might be a bit bigger. So again, it's very easy to avoid things, but it's not always the most helpful way of dealing with things.
100%. Thank you, Adam. And then, yeah, leading to healthy coping strategies. So we've alluded to some of these, but we'll explore this in a bit more detail, and then get your own perspectives, as well as sharing my own sort of introspective look at how I sort of deal with things. So, yeah, these are some of the ones that will probably seem familiar, that maybe, I guess, a bit more effortful. You know, going for a long run versus the scenario that I described earlier, but having a very positive effect for you, right? So these are some of the ways, I guess, that you can look after yourself in a positive way. You know, through our service, we have various tools, particularly when we're talking about, you know, this topic affecting or impacting men. Within our app, you have an exercise called deep muscle relaxation, and that is a really effective tool to reduce anxiety and stress and tension in the body, and something that I think a lot of men can relate to, and that's sort of shown in what we see in the use of our service. But we will come on in a couple of slides to some of your own views on what you do yourselves. So again, we've kind of covered this, but just to sort of re-emphasize the point that Adam sort of highlighted earlier around the difference between taking action with something that you might be able to do. So how can I sort of problem solve the situation versus adjusting how you might appraise the situation in a more sort of from an emotional perspective. So sometimes, I guess, you know, you may be able to remove yourself from a situation, but you may, in the example that Adam gave around physical health, that might not be an option. But there are, I guess, opportunities where you do have the option to remove yourself from that situation. But I know from a personal perspective of avoidance, that then reinforces potentially the situation that's causing you anxiety, right? So we have to be careful about when it's the right time to sort of remove yourself from the situation, but also perhaps expose yourself even to it, even though it might be uncomfortable. Right. And we can flick on to the next one. There you go. That's a good image, isn't it? So I wanted to share a little bit from personal experience. I mentioned at the beginning of the webinar, the reason I work in this role is because I'm very passionate about the subject matter, and I think I have a bit of a varied way that I'll deal with my own stresses and anxiety. So, you know, I don't mind sharing. Since my early 20s, sort of been dealing with anxiety, and for me, physical exercise has always been a very helpful coping mechanism to sort of dealing with the stresses that I experience. So since my early 20s, I've done boxing, and that's something that for me is a bit of an escapism. in that sense. And I'm not condoning that you have to go there and start doing sparring and things like that. But even just hitting a punch bag or hitting some pads, non-contact version of boxing can be really, really helpful, at least from my perspective, to focus your mind, your attention in the moment. And I feel really comfortable in that environment. And that's what takes me away from perhaps living up here a little bit too much too often. So I think some of these things can be a distraction and for a positive reason. But on the other side of that, you've got the avoidance. And I remember a time, it's a couple of years back now, but where I was spending too much time in the gym because I was avoiding the situation that was challenging me. So this can be a really healthy coping mechanism. It's definitely part of my sort of DNA now. Also on the left side of the screen, that's my dog Luna, who sometimes I'm trying to wonder whether she's more stressful, she's a stressor, or she de-stresses me because she's yappy and she tends to go after everything. But that helps me to get out and about and being in the outdoors as well as some of these cognitive ways. So I don't think you can, for me, it couldn't all be managed through expressing things in a physical way. That helps me in the moment, I guess, deal with the symptoms. But really, for me, it was sort of speaking to someone and then sort of reappraising my thoughts and working through it in a cognitive way. So I think what I wanted to get across here is, this is some of my own experience. I've found physical ways to sort of express anxiety, stress really helpful, but also seeking help and talking to someone that knows what they're on about, and can help you through that process can also be really impactful as well. And for me, I know that, there's lots of barriers out there and, we've got varying degrees of willingness to accept help and seek support. But the way I look at it, if I'm going to live the rest of my life, I want to do that in the best way possible. And if that involves talking to someone about it and trying to work through my problems, then I think that's sort of a challenge worth engaging in. Okay, let's hear from some of the audience, from the participants. What healthy coping mechanisms do you personally use? Got Reiki, meditation, exercise, walking, gardening, in the outdoors, talking to a partner, weightlifting there, Brazilian Jiu-Jitsu, got a few people on here. Going for a walk, exercise is sort of reigning through here as one of those things that people find really helpful. And there's a lot of evidence, right, Adam, behind the merits of this, both for anxiety and depression.
Yeah, it's what we call behavioral activation, which is really what you see right there. It's doing things, being connected. Some of those things relate to other people, so doing them with other people has a massive social benefit as well and helps keep you connected to other people. So yeah, there's quite a heavy focus on the behavioral activation part.
I like that one there. Sea sounds. I love being by the coast. It kind of takes you away. Surfing, that's another great one. Kind of you can't not be living in the moment when you've got a surfboard coming over towards you, waves crashing around you, things like that. But yeah, I think the point here is there's various ways, and it's a very individual experience of what helps you, as well as the point you mentioned there, Adam, around the importance of doing things with other people and being socially connected and so forth. Okay, great. Thank you everyone for taking part in that Slido. So let's have a little walk into the future then. So how do we go about this? So what do people think about how we get men to seek help and earlier? What are some of the thoughts there that could be in place to help this? We've got role models. Removing barriers to services, and that's very much what we're about in what the work that Thrive Mental Wellbeing does. Open conversations, normalizing emotion in men. communities opening up. That's interesting. More promotions. Making it easier to start a conversation, so that maybe in a work setting, I don't know where that comments come from. Normalizing it, training there as well. So yeah, you're doing pretty much the homework for the next question, which is what, in an employer setting, what can some employers do about this? The role models is an interesting one. Normalizing it, talking, good listening. Yeah, great levels of engagement in this, and some sort of recurring themes that are coming out of this. Social media in there as well. Great. Changing the narrative that men have it easy. Okay, well, thank you everyone who's sort of participated in that. For me, there's no major surprises in here, but some sort of reassuring themes from the perspective that these are sort of themes that we've been reinforcing and people have been identifying with throughout the webinar, serving as an example as well there. So let's move this into the latter parts of the webinar. So yeah, I think in terms of what can employers do, we started the webinar, actually, Adam, you mentioned around the men's group. So I guess more broadly, creating what we kind of hear as these safe spaces is important. I guess the culture within the employer is important, but even that is not an easy thing to sort of address and change necessarily. So is it about leaders? Is it about leaders opening up more men sharing their stories, or is it kind of it's not just a top-down thing, it's a ground-up thing as well?
Yeah, I mean, there were some great comments on that slide, though. Thank you for sharing your thoughts on that. I mean, I think just to sort of flip it around a bit, when in healthcare, where we have what we call a serious untoward event or an adverse event, you often go back and look at things that you could have done to prevent it. And one of the things that, I'm always reminded of when I've done those sorts of things is creating opportunities to know about the problem. And that goes back to the point we made that, we have to have services that are there. We have to have services that are accessible, and we have to have services that encourage people to come in and share their concerns. So if we're thinking about, how could you replicate that in the workplace? There's many different things that we've learned from organizations over the years. It could be just developing, if you're a senior leader, creating policies that form part of your governance processes for the organization. So there might be something you could do as a leader in the organization or a line manager if you've got responsibility for the well-being of a workforce. And I think that's what that point might mean about, having good role models. If as an employee you see the organization take your mental well-being seriously, then you might feel more inclined to talk about it. Other people have looked specifically at supervision and line management and have protected space within that to talk about the person's well-being. So it's not just about operational or practical matters. There's a space that talks about and how are you feeling and how are you getting on at work. So I mean, it does feel a bit forced because you're kind of creating that, but it's important that it gets addressed somehow. And as Rich said, other people in organizations talk about being the mental health first aider, the person that's a buddy, mental health buddy, or creating safe spaces where people can reach out to one another. But I think it's a whole organizational response, and that's kind of what we're talking about now. We're part of the organization, so it's everybody's responsibility to make sure that we're all okay, including ourselves. We've got a responsibility to make sure we're okay, because if we're not okay, we can't help other people, right? So the answer to that question is employers can do lots of different things and be really creative, but that's also, you know, your gift as well. As an employee, you can really help shape what that looks like for you. So thankfully, there's lots of things that employers and employees can do.
Brilliant. Thank you, Adam. Yeah, so a quick plug, if you like, for something that we think is a really effective and valuable resource. So many people that will be attending this webinar will have access to our service. We provide access to a mental health service. You can speak to a therapist. But if you do want to understand more about how we deal with that, how we reach out to people, we mentioned early intervention at the beginning of the webinar. We have a very unique and effective way to early intervention. We lean into the process of encouraging people to take support for their mental health. And when we follow up in the webinar, there'll be the space to feedback, not only on the webinar, but to get in touch with us if you'd like to understand more. Again, so people who joined on a little bit later, we wanted to share these resources again. We spoke at the beginning of the webinar. You know, some of the content might have been triggering in this webinar. People might want to seek support. They might want to share some of these resources with friends, with colleagues. So again, some of the resources that we have available on this slide here. So lots of really, really good organizations doing great work in this space, and some others sort of more specific to particular sectors and areas here that can help individuals with their mental health and well-being. Which leads us on to the end and just about bang on time. So that's run quite nicely in terms of timings today. But moreover, thank you very much for spending the time, taking the time out your days to join the discussion. We hope that you found this valuable, insightful. And yeah, Adam, I don't know if you've got any closing thoughts on your side.
No, just to echo what Richard said, and thank you. I mean, we learn as much from delivering these sessions as we do, you know, just doing other research pieces. So thank you for sharing your views as well. And yeah, nice to speak to you all.
Yeah, cool. Yeah, thank you for all the comments that are sort of happening and, you know, addressed to us in the chat at the moment. Really good session, and look forward to delivering another one soon. So enjoy the rest of your days. You'll get the recording, and yeah, take care.